Into the colder months and holiday travel season, there is growing concern about a new mutated strain that's behind surges in the U.S. and Canada right now. Early data is pointing to the U.S. heading into its second severe flu season in a row, and health experts say flu vaccinations being down is not helping. So let's bring in Dr. Linda Nava, an infectious disease specialist, to help us understand what exactly is going on. Dr. Nava, thanks for joining us.
Yeah. Thank you for having me today.
Of course. We don't want to alarm anyone, but of course, being
No.
informed can keep us healthy. We're seeing the UK get hit hard already due to this new variant. Does that usually foreshadow what's coming for the US? And based on what you're seeing, how concerned should we be?
Right. I mean, absolutely, it's a cause for concern. We are approaching the season of gathering, and we know during that time flu cases significantly go up. So it's certainly knowing what's happening globally is very important for us to understand what may happen here in the United States.
We're also coming off the longest government shutdown in U.S. history, 43 days. Of course, that put a halt in federal updates. Has that affected flu tracking, leaving states with less data to look at and in turn prepare for the upcoming season?
Right. And we look to the CDC to help us with surveillance, right? And when we think about flu season, we think about preparation and then treatment. And so the CDC certainly helps us with preparation, surveillance. Where is the flu right now? How complicated are the cases? And it really helps us prepare. So the government shutdown certainly has affected surveillance, and we will continue to prepare, but we are looking forward to improving that surveillance. And so physicians like myself that are treating patients can look and prepare ourselves and advise our patients.
Dr. Naba, I think a lot of people at home hear that the flu vaccine might not be a perfect match this year, right? And then they wonder why not? Why is predicting the strain so challenging? Explain a little bit more about that.
Absolutely. So viruses mutate very quickly, and we know this from prior viruses. And so we don't always get it perfectly correct when we prepare for the flu. The flu vaccine is based on strains that we assume are going to be the more common strains during flu season. And so just to let you know, there are actually multiple circulating strains of the flu. It's not just one. And so the flu shot actually has multiple strains in it to help protect. And what we were seeing overseas was a particular type of strain that was causing more infection than typical and not necessarily perfectly matched with the flu vaccine. That has happened before. So we don't want to alarm our viewers, but certainly we've seen this before. Now, the flu shot is still effective. May not be exactly effective on that particular strain, but it helps with multiple strains.
Okay, so even though the vaccine isn't a perfect match, it does provide some protection. That is promising news. Are you
Yeah.
seeing a decline in the number of people getting their flu vaccinations?
Anecdotally, yes, there is a lot of vaccine hesitancy. And I think that we have to be, as clinicians, as physicians, we have to really inform our patients about the flu shot is really our most powerful protection against the flu, even if it is not 100% on par with the exact strain that's circulating. It is our number one protection. Number one, it helps reduce death. It helps reduce, number two, hospitalizations and severity of influenza. And in our most immunocompromised population, we don't have a lot of other protective methods. Our older population, our children, we don't have a lot of other protective methods. So our flu shot is still kind of our, number one way to protect against the flu.
When is the best time to get that flu shot for full protection or some protection?
Well, if you haven't gotten your flu shot yet, please go get your flu shot now. As I said, we were gathering in the next few weeks. We see the numbers go up. So certainly give yourself a few weeks before you're going somewhere gathering. So I would certainly say if you haven't received it, it's now time to go get it.
All right, hearing it directly from the doc, Dr. Linda Naba, thank you so much, infectious disease specialist in Washington, D.C. Thanks so much.
Thank you so much. Thanks for having me.
Of course.